Welcome to ADRA in Tanzania, where we are driven by the purpose statement that says, saving humanity so all may live as God intended.
It's a known fact that most persons with albinism die at an early age, on average 40 years. So for these to die at the age of 40, it's a special case. And this is where ADRA comes in. And they die because of nothing else but skin cancer. So ADRA started this project with support from ADRA International, which is the network office that provided the funds that we could do a pilot project in Morogoro.
ADRA believes that humans meant to love and care for each other by extending acts of mercy, especially to the most vulnerable in our society, such as the persons with albinism. It is our duty of care as ADRA to show mercy and kindness.
Tunafahamu kwamba watu wenye ualbino kwa sababu ya za kiuchumi, mazingira wanakoishi, wanashindwa kufika kwenye hospitali kupata hizo huduma. Kwa hiyo sisi tumewafuata ili kuwaletea hizo huduma.
Albinism, which affects as many as 1 in 1,400 people in Tanzania, is an inherited genetic condition that reduces the amount of melanin pigment formed in the skin, hair, and/or eyes. It leads to poor vision and a predisposition for skin cancer. This cancer is said to be a silent killer for persons with albinism, reducing their life expectancy to only 40 years. Available figures currently concluded that 18,000 people are born with albinism in Tanzania. Persons with albinism in Tanzania also suffer from discrimination, superstition, poverty, human rights abuse, and protection issues, making them one of the most marginalized and vulnerable communities in the country.
Ningependa kuwashukuru kwa dhati kabisa shirika la ADRA kwa kutupenda, kutujali na kututhamini.
Under the Private Grants Innovation Program, ADRA is piloting new cancer treatment for persons with albinism in Tanzania. This new project is a unique one and probably gives the most relief to persons with albinism who live under a constant cloud of death over their heads because of skin cancer. The project tackles cancer prevention, detection, and treatment by the use of cryosurgery technology, which uses liquid nitrogen to remove precancerous lesions from the skin before it actually develops into cancer. Prevention is done by use of radio, public meetings, and SMS messaging. In total, ADRA has facilitated the implementation of 15 medical camps treating 255 skin cancer patients, 48 in Ifakara and Ngeta wards in Kilomero district, 50 in Morogoro municipal, 86 in Mvomero districts, and 71 in Kilosa district, with 15 people referred for further management, while 730 people were sensitized and guided on prevention measures using various information platforms. Medical camp beneficiaries also receive skin protection supplies, including sunscreen lotions, oil, and hats to shield them from direct sun rays.
Pia naomba kuasa wanajamii wasiwatenge watu wenye ulemavu wa ngozi ama ulemavu wote.
Testimonies from the beneficiaries have also pointed at the fact that when persons with albinisms are healthy and know how to protect themselves from infection, they, like other people, are freed to engage in economic activities which will eventually enable them to meet their medical care needs.
Tunatoa mafuta, losheni ambayo inasaidia kukinga mionzi ya jua.
Health is everything. The main challenge has been to do with logistics. For example, Tanzania Albinism Society had limitations in traveling to mobilizing rural communities ahead of medical camp days. As they depend on public means, we do not easily reach intended communities. The other challenge is to do with the referrals for the critically sick patients who need specialized treatment. The project did not have ample resources to handle critical cases which needed this kind of treatment. It is important to appreciate that cancer treatment is expensive, including travels to the facilities located over 500 to 1,200 kilometers from most of these communities. On discrimination and stigma and abuse of the rights of persons with albinism, ADRA has been engaging faith communities as well as government personnel in a way to advocate for their rights. In addition to working on upscaling provision of skin cancer services, which are badly needed in all regions of the country. ADRA, in partnership with like-minded players, plans to identify and give voice to issues that affect persons with albinism in the country.
Thank you, ADRA.
We thank our donors for the funding and the government of Tanzania for the support they gave to make the project possible. It is also true that without the support of Tanzania Albinism Society, the operation would not have been possible.
Kila mtu ana haki ya kupendwa na kuthaminiwa. Uchunguzi wa awali wa saratani huokoa maisha.